looks like we have a really long agenda, but I think we've discussed a lot of it already and we've heard it, so it should go quickly. I'm going to turn it over to Michael and let him fly.
Thank you, Ms. Cinda. Number one, under staffing, what we did, we just organized our thoughts a little bit better since last Monday. Under elementary, we're asking respectfully for the board to consider posting the vacancy and allow us to interview and advertise and post for a certified school nurse. I think we presented the cases and the rationale behind that previously. And we need up to 5 elementary teachers. If you look at our class size guidelines, we're well within those guidelines. Full disclosure, Ms. Brode will be hiring 4, right? And we up to 5 in case numbers grow, in case something happens over the summer, that we have enough leeway to continue to hire. But at this point, we are looking to definitely bring back 4 up to 5 elementary positions. And that's based on those class size projections that the committee and the entire board was provided that you can look at for the rationale or the class sizes for your own perspective. Additionally, at the elementary level, we need 2 special education positions that need to be filled due to retirement. Before I get into secondary, Ms. Cinda, is there any questions regarding elementary that you would like to discuss at this moment?
No, I just want to be clear that for the up to 5 teachers, you're going to advertise and post for 5 so that you can see what's out there?
Yep. And just to see if we need it based on class size. Right now,
Okay.
depending how this conversation goes tonight, we may only have to hire 1 or 2 or 3 and then use the synchronous teachers to go in and fill that role. So,
Right.
but right now we're asking a permission to 5 and we definitely need 4.
Okay.
Okay?
Yep, thank you.
May I ask?
Yes, ma'am.
So what special education positions are open? Are you looking for general? Are you looking to fill specific positions?
Well, right now we have until May 30th to let the staff know who requested a transfer, where they're going. So right now we're definitely need 2 special ed positions. We're going to look internally to see who requested transfer to see if we can make better movements. So right now it could be autistic positions or it could be life skills. We're not necessarily sure right now. We know the retirements came from 2 learning support positions,
Okay.
but people did put in requests for transfers and we have to weigh that. We have contraction until May 30th to let them know if we're going to move them. But right now the vacancy is in learning support at the elementary, both at East Pike. But again, we're going to look at the, where we decide based upon their wishes to transfer and see where we're at a later point. Okay. Ms. Cindy, can I move on to the second one?
Yep.
Under secondary, we have a special education vacancy at the high school. This is a result of Donnie Bowers being promoted to assistant principal. Again, we're going to look at the request for transfers to see how that impacts it. But at this point, we at least know we need special education, whether it's learning support, life skills, autistic support. That's something we'll determine later internally is on our side, but we definitely need a special education teacher. We also need an earth and space science teacher based upon a retirement. We do have 1 candidate internally who has requested a move to biology, so we're going to try to honor that. So thus the opening would be earth and space science. Family consumer sciences, as we talked about last week, was due to a retirement. Social studies is also due to retirement. Physical education, we're going to talk about momentarily, and we'll save that for last. We want to move on next to behavior and mental health coordinator, school psychologist. As you know, Ms. Cinda, the board asked for a job description. We provided that. We also provided some rationale discussion at academic committee meeting surrounding that. We also at the junior high are going to need a business teacher, BCIT, or STEM certification endorsed, and English with dual certs preferred, as well as a long-term sub in ELA/ESL. What we really need a decision on is physical education. What we want to do as an open, honest conversation. And the one thing I'd like to do, Ms. Cinda, if it's okay with you, I'd like to preface the comments by saying whatever the board decides, we'll run that play. But what we're trying to do is manage both our financial and fiscal obligations as well as the academic needs of kids. Whatever decision this board makes, we're going to run through that and we'll make sure we do exactly what's directed of us. But we sent you a couple of videos, we sent you a couple updates. We just need some direction on what way this committee would like to go.
So for the physical education, that's the one where we're considering driver's ed at the same time, correct?
Absolutely. Yes, ma'am.
Can we go back for 1 second? The special ed position at the high school, Donnie Bowers he had 2 hats that he wore. So we're hiring a full-time special ed. What are we doing with the dean of students?
We would. At this point, we've seen, and I'll defer to Justin and to correct me if I misspeak at all, we've seen a high number of kids be qualified, be identified for gifted education. So we're running out of supports in that area. So what we'd like to do is bring this position back full-time and then empower the administration at the high school to split their schedule accordingly. We have kids who need gifted services. We also need kids who need special ed services. So at this point, we would not bring it back as special ed /dean of students. We would recommend we bring it back fully as special ed, and then empower Wade and his team to make a decision how they want to organize or parlay those different types of responsibilities accordingly. We've seen an increase in number of kids that have been identified as gifted, which is a good thing, but we need some additional staff to help out meet those services.
So the dean of students will be adjusted, shifted throughout the rest of the building administration?
It won't.
Are you going to look to hire somebody else?
No, but can we look at repurposing people? Sure. We'll defer to Wade for that. We'll let Wade give any input that he may have on that. But in this case, we met with the team last Friday. We had a discussion, and we definitely would like to bring it back full time. Not that the position wasn't valued or not that it wasn't necessary, but we see some greater need in the area of gifted services and special ed that we need to account for.
Okay.
Wade, anything I misspoke that you want to clarify on?
No, not at all. We're looking at our schedules, looking at individuals, and seeing if anybody's interested in doing that. We're also looking at, Doug and I are going to assume that until the end of the school year. Our first order of business is to get somebody in for special education.
I think Ms. Leeper has a question.
So the full-time special ed will be full-time special ed, or they will also be in charge of gifted?
It's going to be a little bit of both. So they'll have a roster, they'll have a caseload, but they may have some gifted services that they have to provide, because I think that was a shorthand that you had
Perhaps
shortcoming.
Justin and I were talking about that today, looking at those increased needs, looking at the caseloads. But again, our first order of business is to get a special education teacher in there.
Justin, do you want to clarify?
Yeah, and just as far as caseload numbers, I mean, so even if Donnie Bauer's position was not replaced just caseload wise, we'd be looking at mid to high 20s, which is a lot for learning support. And so I think if that position was full time, I think we would be able to keep numbers in the low 20s. Which I think is ideal, especially to be able to get the students the amount of supports that they need. So that position being full-time special ed, I think, in my opinion, is the right route to go.
So without pulling them for gifted?
I think so. And I think there's some other ways that we can look at, handling the increase in gifted support students as well too. But I think we still have to vet that out a little bit.
Okay. So just to be clear, when we're voting on this tonight, we're voting for 100% of this position to be special ed or not?
Yeah, I would say so, yes.
Yeah, I mean, you're tying our hands. I mean, you're voting on a position that we need to bring back. Now, does one period mean it goes to gifted education? Does that take away services from a lot of kids? No. It would be dependent upon the schedule that Wade creates. Ideally, I would say I'd like to all of it be special ed, but if there's a need with some gifted management, I don't want to lock us in to say he can't use that person for that role.
Right. I guess I'm just asking questions to clarify, to know what I'm voting on. I'm not wanting to tie anybody's hands, but just for clarity. So then the majority would be special education.
Yes. Wade, I'll defer to you.
Yeah,
That was my
If
understanding.
there would have to be like a period or two that would be devoted to gifted, I think that might, as far as flexibility, that might be all we need. I think we're going to have to we're still going to have to vet out. We definitely need the position. It's just a matter of vetting out, with the caseloads of special education population and gifted population, there's a need for really both areas. And so I think we just have to vet that out.
And there's a lot of paperwork that goes with both of them.
Yeah,
So
absolutely.
it's
Absolutely.
not, right.
Yeah. And anytime we hire, we try to search for people with multiple certifications to give us flexibility. But the majority of that person's day is absolutely going to be centered on special ed.
So is there a cert for gifted?
No,
There's a gifted
an
endorsement.
There's an
But you don't
endorsement,
have
but
to
you
have
can
that.
have any
No.
certification.
Guidance counselors could do that. Teachers can do that. A lot of the teachers in this room cover some of those roles. So yeah, we have teachers having periods with it.
And if I can say, so much depends on student requests for the schedule, because those requests will determine the numbers of sections. Those sections determine the number of assignments. So we have to find a way that the gifted caseload managers have so many students on their roster, it's limited. So we have to see where those gifted caseload managers can occur. If we have to dip into special education for a period or two, we would do that. But it is our priority to replace that as a special education position.
Thank you.
You're welcome.
Ms. Cinda, we have a guest here, Mr. Matt Frank from the Open Door Crisis Organization. We had lunch today. We were talking about some of the need with mental health from around the area, around the county. As this has been an ongoing conversation at most recent committee meetings, I thought it'd be good to bring him in for his perspective, what he's seeing across the county. So we've been talking much about the school-related issues and what we are facing here and challenges we're facing with regards to anxiety, depression, discipline, and other mental health issues. We thought it'd be important, though, for the committee to hear from someone from the county to take that in perspective and ask any additional questions. As you know, we also have Shelley and Kylie here tonight as well that you can ask from local-based decisions. But if you're okay with Ms. Cinda, I'd like to give the floor to Matt to give some perspective of what he's seeing across the county. And when I say county, Matt, correct me if I'm wrong, it's Indiana and Armstrong. So there's 2 counties that you service, correct?
Correct, yeah.
Okay.
And also see that that's preferable.
If you want to, or if you, we'll have to give you a microphone now. Wait, there we go. We'll give you a microphone. Other reason why is the people online can hear you, sir.
Oh, okay, absolutely.
So Matt, maybe you could tell them a little bit about your role, what you do, what your organization does, and then proceed into what you're seeing at the county level.
Yeah, absolutely. So my name is Matt Frank. I am the Crisis Intervention Coordinator for Armstrong and Indiana Crisis. So what we operate is a 24-hour crisis hotline that is open to Armstrong and Indiana counties. Our purview is to offer crisis intervention services to the public as a whole, the community as a whole. So again, because we cover 2 counties, we do go anywhere and everywhere when it comes to crisis intervention, right? So we operate, again, a 24-hour hotline. We also offer individual services, individual team members that can go out into the community at any time of day. We have 1 staff per county. So right now I have ultimately 2 staff on right now, 1 to handle specifically those face-to-face services in the community of Indiana County, and 1 for Armstrong at this moment, at any given moment. We also offer walk-in services at the Indiana location only. And again, this is supposed to handle crisis intervention. It's a broad kind of responsibility. We really respond to any request that we get from the community, and when there are multiple requests, we have to prioritize. I mentioned that to say when we're working with schools, right, we do not have specialized staff members that respond to schools. So obviously, if there is a need, if any administrator, if any school guidance counselor, and again, obviously internally how you guys determine when you make that request, we will respond to any school in Armstrong or Indiana County. We have worked, I've been to, I'm going to say most of the school districts, if not all of them in this county over the course of the time that I've been doing this work. One risk that we run is, again, any request that is made, we will consider it. And if there are 2 requests simultaneously, we do have to determine which has the higher priority and respond to it first. Excuse me. The risk that we run into is if there's a request from 2 schools at the same time, we do have to prioritize, and I have 1 staff member to send. If, again, because we serve the community as a whole, we'll go anywhere. We'll go into personal care homes, into schools, into private residences, we'll work with community mental health organizations, other providers of outpatient mental health therapy, and even potentially recovery. We've been kind of anywhere and everywhere. And because of that, again, because of that, our the matters that we handle are so broad, and because we can go anywhere, we aren't able to respond specifically to schools. Now, part of our conversation when Mr. Vukovic, Heinrich, and Zahorchak and I were discussing earlier, and we've met a couple times, I started to give a perspective on what the county is seeing as a whole. So again, I can't represent the county. I did check with Behavioral and Developmental Health Program with Tammy Calderon and Joe Budis, and we had a small discussion on, what to share. Again, I can't represent the county. I can only represent our organization that's contracted to do the service. So in general, what we're seeing is an increase for requests of many different kinds, not just the schools. Roughly speaking, in terms of school mobiles, so not just calls where people are saying, please call this person, follow, but specific, please come out to see us at the school, or hey, that student just got on a bus, please talk to the parent, offer your services at their home, and we'll drive out and meet them and do what we need to do there. Often this does involve an assessment for safety, risk assessment, suicide risk assessment, and or a safety plan and or coordination of care to other services. So again, they're broad. If we're going out, it doesn't mean that that student or that person, right, again, for the broader community, is definitely going to a facility. We try to refer them to the specific kind of help that is fitting, for their need. When we're looking again at all the incoming kind of requests for help, in my work, I speak quite often with different agencies, law enforcement agencies, the hospitals, school districts, some of the outpatient providers. And I also function as a member of the Indiana Suicide Prevention Task Force, and I chair the Education and Prevention Subcommittee. So we have a lot of conversations, and in those conversations, I'm hearing about generally the elevated needs since COVID has started. So obviously, as educators, I'm sure you're familiar with learning loss, the lack of structure that many students have not had, and now they're returning to the classroom, or they have been, and you're still filtering through some of those problems in the classroom. Social emotional learning, I'm sure you guys have discussed that. Specifically, what we see is a lot of our calls, in general, they're going up. Overall, the calls are going up. Overall, the acuity, we are seeing a higher acuity of need, more psychosis, more dangerous behaviors, right? More higher risk for suicide and some other issues. In general, we are also servicing more unique individuals than we ever have before. So we're breaking through all of the records that we've held pre-COVID. We talk to more people every month. We have more calls about, in general, all of those individuals, and we are going out at higher rates. For this January and February, typically winter months, we don't go out that often because of the weather, usually because behaviors are down, because typically people kind of hibernate and those issues don't really boil over, and then they have a need for crisis. In fact, we've been out probably between 40 and 50 times in terms of face-to-face services. Now that number doesn't mean anything to you, I understand, but in general, that's probably double the normal number we would see for any given January, any given February, again, pre-COVID. So a lot of these issues are there. And in the community as a whole, I have law enforcement agencies calling us and asking, hey, let's discuss our existing policy. Let's discuss additional resources that may be helpful, because their calls for mental health concerns are up. EMT transport, right? Emergency services, when they're transporting within the past year, I've been given numbers indicating an increase. I was asked responsibly, hey, what was the number before? Talk to us about that trend and that increase. And I don't have exact numbers to point to. Those aren't my organizations. However, I'm told about a trend where emergency services are transporting more people from strictly mental health need alone, right? Typically, we think of emergency services or the hospital for use with, certain medical issues or medical emergencies. So they're seeing more people and doing the best they can, because an ER is not a place for mental health treatment. And they're seeing and handling more of those issues than they ever had before. So much so that the hospital, our local hospital, IRMC, goes on what we call psychiatric diversion. And what that means is if someone is being brought in, let's say by ambulance, this hospital will communicate, we are at such a need. We have so many psych patients, right? Exclusively with the psychiatric issue, or mental health issue, or they're suicidal and they need that kind of treatment, that we can't take anymore. So please send that ambulance to a different hospital. No one's going untreated. We're just at capacity. We can't handle those issues right now. We need to maintain a certain level of beds for the other medical emergency, your car accidents, your typical concerns that would result in an emergency room visit. 911 dispatch, I've had conversations with them, and they've been handling more calls specifically to mental health. Typically, those calls would get directed to my agency. My agency, again, 24 hours a day, we would be handling calls about mental health need, about suicidal thinking, and be trying to manage that. They have successfully managed to respond to certain individuals that have called expressing that they were actively suicidal, and that number of times that they've had to do that has increased. In general, every conversation that I have in any system, again, because crisis, we talk with so many people, we go to so many places, every system has an increased need right now. In addition, the correction system, right? Our jails and our Armstrong County Jail, Indiana County Jail, the prison system, they're all dealing with more. They're doing all of that with less workers. Right now, unless this has changed, Armstrong County Memorial Hospital, they have their ER. They also have two specific units, 2A and 2W. 2A is their inpatient psychiatric floor, and they have 2W, which is their detox and rehab floor. Apparently, because due to a nursing strike, those floors are closed. There are no patients on those floors right now, which means our local capacity in terms of our two counties to find someone in the community who is in need of intervention, and we determine they, in fact, don't just need a safety plan. They don't need a referral to their therapist to communicate about what's going on. They need specifically to go to a hospital. Those sites where we would typically send them, well, 2A is closed as of right now, unless this has changed in the last couple of days. That site is closed. No one can go there. There are some plans in the future that we won't see, to help handle this need at the county level, right, in terms of the overall system. But it takes time. It takes time to get these programs up and running. And so again, we're trying to do everything we can with the same number of staff that we've always had. And all of these systems are experiencing that high need. For the school system, again, more specifically, we can be requested by any school administrator or any school system, at any level that would require crisis intervention. My worry, and I've always cautioned the schools to understand, I can't staff more in response to a higher need. I can't staff more in response to schools for higher need because again, we are dealing with the entire community as a whole where we get our requests. So I hope that's given some, I guess, perspective on the county mental health need as a whole. In addition, the last that I'll bring up is the inpatient units, not just including the ones in our county, the ones outside of our county, Clarion, the Meadows, Western Psychiatric, these facilities, they have been dealing with staffing shortages, Conemaugh as well, Conemaugh Psychiatric, right? They have been dealing with staffing shortages for over a year. And so the number of beds, right, that they would, if we say there's 100 beds available in a certain facility, they're only able to actually staff enough nurses to responsibly fill, let's say, 60 or 70 of those beds. So it's not a matter of infrastructure, it's specifically a matter of staffing due to COVID, whether it's active infection, whether it's the workforce not wanting to apply and work in that field. That obviously puts an additional burden on those people who would otherwise be seeking that inpatient need and receiving it. Obviously, if there's any, I'm just not sure of the format, I'm sorry.
Yeah, a question for you.
Sure.
I think you said that a lot of these folks are in trouble with mental health issues are being transported by ambulance
Yes.
to the hospital, and that the emergency room is not the appropriate place for them to go. So,
Yes.
so what is the appropriate
Right. And
place for them to go if it isn't the emergency room?
that's a good question. And let me be clear. If there's an emergency need and someone feels they need to go to the hospital, they need to go to the hospital, whether it's for suicidal thinking or not, to be fair. However, what I mean to speak about is the idea that emergency room is not the right place for treatment. Can you be assessed and will you be safe? Absolutely. And if it comes to it, you should absolutely go to the hospital if you feel the need to. Any call that calls into my hotline and they say, I'm not sure if I should go to the hospital. If it's a medical issue, we'll tell them, I'm sorry, I can't give you medical advice. If they say, I don't feel safe and I can't wait for you and I can't safety plan, then we will suggest they go to the hospital. If they identify that plan themselves, I would prefer to go to the hospital. We're not going to tell them not to do that. We will give them, we will try to encourage them to seek the alternatives. We will never tell someone not to go to the hospital. We will encourage them to consider direct admission. That's where they work with us. They have to be safe to a certain degree to be able to go to be able to go directly to an inpatient mental health facility, acute psychiatric care.
So then the emergency room doctor would do some sort of triage to determine it was a mental health issue and then refer them on down the, I mean, we have an emergency room doctor here too, but
Oh, sure. Okay. I actually can't speak to what happens internally, but yes, if anyone shows up with that need, they may stay there for a certain amount of time. Internally, whatever policy, whatever physician happens to be on will determine what the need is. Ultimately, it may happen that an individual stays in the emergency room for up to 8, 12 hours, 24 hours, multiple days potentially. If they're not safe, they need to be safe. I'm not saying no one's turning anybody away from treatment. The problem is an ER is not designed for treatment, is what I mean to emphasize. It'd be better if we could take that individual and find them acute psychiatric care in a facility that specializes in exactly that treatment and send them there. Obviously, and don't get me wrong, I'm very happy with our partners at RMC that work with the community and work with my organization, because they're doing the best they can to meet the needs of those individuals, even in an emergency room where, again, it's not designed for treatment. So I don't mean to say that people shouldn't go to the emergency room. I mean to say there are alternatives, available, and I want to make them aware of that and give them those options so they're not waiting in line, waiting in a waiting room, or sitting in an ER bed when, again, that is not specifically designed for treatment. Does that answer?
yeah, Jim?
Well, he basically said it. If someone presents to the emergency room with a psychiatric condition, they receive a medical clearance exam to make sure it is indeed psychiatric and any medical issues are handled. And then we look for placement, basically. You contact facilities.
Okay.
When I work at Katanning, you call upstairs and you are correct. The upstairs is closed now. So for the last week, we've been calling out to other facilities. Do you have a bed available for 28-year-old male? Those kind of issues, and you present the case, and they have to get acceptance. So it's a long process that can take days. They'll be in the ER. You try to do the best you can to manage the acute psychosis, whatever issue they're handling. But I'm not a psychiatrist, I'm an emergency room doctor, so it's difficult to manage.
Okay, thank you.
Sir, can I just say?
Sure.
I'm so grateful for your organization and you make a difference and thank you for everything that you do.
I very much appreciate you saying that. Thank
Because
you.
you made a difference in like my personal life too.
Okay.
Like just your services taking someone to the ER, like you made a difference. You
I-
should know that.
I'm very happy to hear that. We don't often hear that. We do typically see people in their worst moments,
You do.
and we don't get the follow up. So I appreciate you very much saying
I
that
just need to
because
say that.
thank you. Oh, thank you for saying that. Yeah. And obviously, again, I'm trying to give you a county perspective. I understand there's a need in schools. I understand there's a consideration for additional mental health supports in schools. That's the topic.
Yes, sir.
Would definitely encourage you to consider those options, especially right now. I think the need is there. I think overall this potentially these positions could be of use. And I'm sorry, I don't know the specifics.
Ms. Cinda, we met today and we were talking about QPR training. Is that the right acronym?
Yes. Yeah.
QPR training for our staff to help recognize the signs of
QPR
suicide.
means what?
Question, persuade, refer.
There we go.
Yes. So
Say that again.
specifically, question, persuade, refer. QPR.
Okay,
Yes, these Mr. Vukovic is referring to a few different training options that we have available in the community. A lot of these are free. Some of these come more costly. So at the Open Door, we are attempting to make available these different trainings to the community as a whole and to our other agency partners, whether they're schools, whether they're outpatient facilities, whoever would want to come and be trained. We're trying to make that happen. QPR is specifically question, persuade, refer. And again, it's training on how to have a conversation about suicidality with someone for the layperson. So you're out there, your neighbor, your friend, your coworker, your student potentially says, I'm struggling with this. How do you specifically ask, right? How do you know you're asking the right questions? How do you persuade them to overcome the stigma and find the seek treatment? And then who do you refer them to? Who do you call? You might call my organization, you might not. You might call your SAP teams internally. You might make a call to, again, at the school, or you might call an outpatient mental health provider and try to get them in with the treatment there. So again, that's a general training. It's 1 hour. It is free. That is available through volunteers through the Indiana County Suicide Prevention Task Force. In addition, there are some, and I didn't mean to, I guess, overshare there. There were a couple other training options that Mr. Vukovic and I have spoken about on a couple of occasions. Mental health first aid. There are some options to get that for free due to some different cooperation between other nonprofit agencies or actually even some for-profit that are trying to be helpful. And in addition, there's also an ASSIST training. It's not spelled correctly. It's ASIST. It's an acronym. All of these trainings, they start at QPR, which is 1 hour. It's for the layperson. And then they essentially, mental health first aid is roughly 8 hours of training. It's a bit more in depth. It covers more of your mental health need and your substance abuse need in general. That can be geared towards teens. So for example, if you had teachers that were interested or school administration, you could have the child adolescent version or the teen version essentially and experience that. That's 8 hours. Sometimes there is often cost to that. We have been able to secure a training for free in May, and I'm going to share details. Actually, I think an email went out to you. If there's interest in that, we invite the community as a whole to attend. It'll be in person at the Open Door, and we'll bring in those trainers. We're not providing the training ourselves. We're bringing in those trainers who will provide that training. The ASSIST training is rather intensive. It's 2 days in a row. And I wouldn't necessarily recommend it for your average teacher. It's a bit more of an intense conversation. I think it's more helpful for first responders, police, EMTs, maybe certain hospital workers, potentially your school your school counselors, school psychologists. That could be helpful there as well. It's a bit more intensive. Although if you're a clinician, I might recommend AMSR, which is, I don't have a route to get that, but that's another stands for Assessment and Management of Suicide Risk. So again, all of these trainings are available. We're working on them. That's not just the Open Door, but also as in my capacity as the as the chair of the Prevention and Education Subcommittee of the Suicide Prevention Task Force of Indiana County. I, along with a ton of very passionate volunteers, are ready to try to assist with those things. So.
Are you a county employee?
I am not. We are contracted by the county to
Okay.
provide the service.
The reason for the question, and I didn't mean that to be a personal issue,
That's okay.
was the school district has a captive audience. So we have a certain amount of, with parental permission, control over programs and things like that we can do to help maybe be more preventive in trying to eliminate these types of issues. My question is, what, or is there anything that another local government agency, such as the county, the borough, White Township, are there programs that they can do, implement, what have you, to so that this is more of an entire community approach to this rather than just operating in our separate silos? What's your experience in that?
I do believe there are. It's really just a matter of finding an individual that represents a certain population. Obviously, I talk to school administrators. They represent the student population, so it's easier to have that conversation. They are willing to talk about their students and their faculty. To be honest, these suicide task force is open to any member. We have general meetings. We will encourage them to take a specific role in one of our subcommittees. That's either prevention and education, intervention, or postvention. So we are ready and willing to work with anybody at any level, whether that's local law enforcement, whether that's local government, whether that is school administration. In addition, there are some programs I guess I'm not involved with directly. The county has a few different resources available, and Mr. Vukovic has described some interest in some of those things as well. We've talked and I've shared that. And I'm sorry, I may not be able to answer your question fully, just as I don't represent the county. But I'm aware of a few different things.
So, Ms. Cinda, it's part of our MTSS model where we're trying to equip teachers with the right skill sets and tools they need to be able to handle this job. Because years ago that this wasn't such a prevalent need, or it wasn't really much in our training as it is today. It's at the forefront. So we're trying to see what we can do with partner with outside agencies to help us understand what we're dealing with, not only as a school, as a community. So I really defer to you and the rest of the committee, see if there's any other questions for Matt Frank, because what I want you to do is make a decision that you think is best based off the information that Shelley and Kylie and her team gave last week now as someone who's doing the work in the community. So we really want to defer to you, see if any other questions for Mr. Frank. If not, then I'll defer to you. How do you want to proceed?
I have no more questions. Is Terry online?
I don't. Jared, is he online?
I'm not, I don't have any questions, Cinda.
Okay, thank you.
Okay.
Yeah.
All right, thank you, Matt.
I'm good.
Okay.
Thank you, guys.
Okay.
Thank you.
Thank you, Matt. Thank you. So, Ms. Cinda, if it's okay with you, the next one we'd like to talk about, unless there's any other comments you want to discuss about the previous position.
No. So we got stuck on the behavioral and mental health coordinator.
Yep, I think we just
Okay.
addressed that, if you're okay with it.
I do have a question about where will that job description be posted? Because I have some issues with the formatting and
Oh, we can fix that. Oh.
Yes, ma'am.
You'd expect anything less, Mike?
We can clean that up. Yes,
it's just little stuff, but if it's
Yes, ma'am.
posted just for us to look at, that's one thing, but if it's going out, it needs to be.
For now, it's just for us, but yes, it will be going up.
Needs to be tweaked.
Yes, ma'am.
Okay.
Yes, ma'am.
Also, that's a pretty hefty job description.
Yeah, it is.
When I read that,
Kylie
We
and
have
Shelley,
something-
do you want to?
I walk on water.
Yeah, do you want to weigh in on that burden? Because Dr. Ring, that's an understatement. She's right. It is pretty hefty. And do you want to talk a little bit about the rationale behind it? We empowered them to work with us about what does the position look like? Because I know if I got the perception from the board correctly last week, look, we want it, but you better be with kids too. So we made sure that was a focus of it. But there's still a lot of work to do too. But you ladies want to explain that a little bit, rationale behind that?
Absolutely. So whenever we looked at, what would this include? You have to have obviously direct service. So that would be looking at your counseling, but then you have all the other pieces that go with that when it's in an MTSS framework. So you're looking at, from the behavioral mental health side, you start with your tier 1, which is your school wide. And so you need someone that is sort of a checkpoint there that can do a lot of data analysis and making sure that the screeners are the appropriate screeners, and being able to form groups so that we're intervening on the appropriate things. So when you look at how that position would work, you have to have someone that is looking at data, picking interventions based upon that data, and then being able to implement the intervention. So that's the biggest part of the description. But then along with that, when you look at roles of a school psychologist in a comprehensive model, you have to have someone that's able to perform all of those roles. So although the main focus is going to be on that direct service, in the appropriate way that I just talked about. You also need someone that when it reaches that level, that you are going to go to an evaluation. If this person has worked with that student, it would make sense for that person to conduct that specific evaluation because they have the rapport and they have the background. So the school psychologist role comes into play there, which adds a lot of the extra bullet points that you see as far as that goes.
And as I look through them, I understand the model, but I was thinking some of these could really be condensed. I mean, data collection, not quite that general, but I just think that all of these bullets, like I said, he's going to look at this job description and say, I don't think so. No, thank you. I can be a school psychologist elsewhere and only have,
was this job
5
description-
bulleted.
Was this job description written so that we could hire Tim Runge for this position? Because it almost sounds like it.
Yeah. I mean, your crisis, what is it, bullet number 1, 2, 3, 4, 5, 6, 7. Creating the safe, positive school climate by crisis prevention, intervention, and postvention services. I mean, that covers a lot of the different pieces of this job description. So
Yeah.
I don't know that everything would have to be bulleted out as specifically as you have on here for a posting of a job description. That's my thought.
And if the board would like, we could absolutely look at condensing and shortening that. That's not a problem at all.
I think it's helpful to see, for us to see it, but then to actually post it this way, I think it's going to be difficult to find.
Is that in part what you were going for as well, Cinda?
No.
Oh, okay.
Mine was editing and correcting and
Okay.
spacing and formatting. But I did think it was really, really long, but what it did was I knew you guys wrote it and I knew you looked at your jobs and what you do and all of the different things you do. For me, I might have somebody say, oh, we're going to do an intervention or a prevention. Well, what goes into that? I know that there are lots and lots of steps. So it was helpful for me to see it because it really explained to me how much there is in your positions. And I was grateful that you guys took the time to really delineate it so that we have an idea of what really goes on. So for somebody else somebody already knows the job and looking at this as a job posting, maybe condense it, but I appreciated how detailed it was.
So how is this different from the current school site job descriptions?
So this would be more of a focus on the behavioral mental health. So really looking at being able to provide more comprehensive service in that area.
Okay, so currently we're just doing the groups and not that what I'm
Correct.
in, not as much one-on-one or individual or in there, you're not following the students to eval level, et cetera, et cetera.
So right now we have the ACRP staff that's also hired.
Right, okay.
And so they are able to do some of those pieces at the elementary level and 4 or 5 buildings. So this would be taking that role and combining it with the school psych with the focus on behavioral mental health.
Okay, and then I do have another question. So the trainings that the gentleman from the Open Door discussed, are you trained in those areas? Like, do you know what he's talking about?
Yes, I actually went through QPR training a few years back in my previous role. But our training, school psychologist training in general, does do a lot with threat assessment and suicidality. But those are specific programs.
Right, that's what I thought, that you sort of spoke the same language.
Yes, absolutely. We know all the acronyms.
Okay, at least I hope you would. Did you find out my answer to the question?
I sent it to Justin. Justin, I sent you about the inquiry about billing. Can you respond to that?
Yeah, so right now, as far as billing is concerned, the only thing that school psychologists would be able to bill for is the testing that results in an IEP. What I found through and talking with other directors of special education, Indiana has never done billing for school psych services for testing. What I found was that the amount of reimbursement that you receive is almost not worth the time that it takes for you to fill that form out. So I reached out to the other directors of special education in, at least in Indiana and Armstrong County. And I don't think there is any school district that does billing for school psychology services.
I was just curious because as a speech path, we bill for our services in the school, so I.
Yeah,
thought
and
that
we
might
do
be-
that too, as far as our SLPs, but it just, for the amount of time that it takes versus the amount of reimbursement you get,
And that's
it's, yeah.
I was just curious. Thank you for checking.
Kylie, anything from your perspective?
Thanks, Shelley. Summed it up just well.
Okay. Next one we need to talk about, Ms. Cinda, is what is the pleasure of the board with regard to driver's ed? As you know, we talked about that. Our position is if you bring back driver's ed, we are going to need a full-time physical education teacher to be able to service those kids. If you don't, Wade and Rob had a conversation the last couple of days about different alternatives. We still need a position, right? We're still not going to say just eliminate position. We still need some other services, and we'd like to have the conversation, but it really starts and ends with the board's directive or expectation regarding driver's ed. Because if you need that, then we need a person back to fill in Jody's via her retirement. If you don't, then we have other options that we'd like to vet further, but we need to have a conversation so we know what we're doing as far as staffing. So we'd like to have that conversation now. As you know, Rob sent a video to the board. I'd like to give the floor to Wade to talk about how Wade can, if the board chooses not to go with driver's ed, what that would look like so you're aware of everything, and then see where the conversation go. As far as us as administrative central admin, we'll do what we're told. We're fine with whatever. We just want to bring it to light so we know what we're doing as far as posting, because we'd like to get on that and still hire by the end of June if possible. Does that make sense, Ms. Cinda?
Before we turn it away, there's basically three possibilities for the board. Possibility one is you eliminate driver's ed, take it off the table, and don't offer it at all in Indiana School District. The other option is you can move it to an after-school or summer program, or three, keep it within the school day and in the curriculum as it is now. So those are the three things that we've been talking about as as this program, as this developed. So I just want to make sure that everybody understood the options on the board.
When you looked at the options,
Yes, sir.
since you're talking about the bigger picture options, was there anything looked at as far as Aaron? Because I know at one time they had a driver's education program that the districts could, and we chose at that time, Tom probably remembers this, we chose at that time not to select them for, I don't remember why, but,
They had limited capacity at the time.
oh, okay. So was Aaron?
I have not, no, I haven't.
Okay.
I called Aaron last year for driver's ed for my daughter. They no longer offer it.
Okay.
So
What about outsourcing it? Is that a possibility
I would
as a number 4 option?
I would say probably not. I think the union would have a pretty solid complaint there to say that we took away contracted work and went to an outside agency. I think that they would probably have a pretty solid ground for a grievance on that one. But
It would preclude families from choosing that option on their own. We just couldn't. It would not preclude families from choosing that option on their own. We just couldn't replace it with that option. There would be a claim of diversion of collective bargaining work.
If we don't offer academic credit for it, can we fund it all? Could we fund it, outsource it?
I
If we don't
Probably
offer
still think
academic
it's the
credit.
same argument would apply.
we didn't give academic credit before when Mr. Sokol instructed after school. It was just a service we provided.
How was it done when Canton's was teaching for us? 'Cause
I
I
don't
know,
who that
I
is, I'm
know
sorry.
students who, they were
Yeah.
Indiana students who.
I don't know.
in Canton Driving School.
Oh, it's a driving school. I didn't know what that,
Before my time.
I don't
Sorry,
know.
I'm way you.
I could offer some insight. I'm Pete Boyd, Health and Phys Ed and driver's ed, newly driver's ed teacher. So Joe Sokol retired last year. I took over the program, created a new online curriculum, hybrid online. We do driving in person, we do online coursework. So I'm here kind of as a bridge to the board and admin to kind of, be part of the discussion. So as far as Canton's, I'm not aware that Canton's was part of the high school driving program. I know Joe Sokol and
Georgianne Milner.
Georgianne Milner both did that program for 20, but you'd have a better idea than I would, over 20 years.
I say around that time, yeah.
Okay. Wait,
Yes,
go ahead.
Pete, you want to come up?
Yeah.
Pete was part of the conversation. Anytime that there's an opportunity to replace a position, we charge the administration take a deep look at all of the factors what's important, how should we replace that position? Are there other needs within our building? Heard Mr. Frank speak very much on the increase of social, emotional, mental health needs that are going on, not only within the community, but also we're seeing increased needs among our students. So balancing that and looking at the position. Currently, we have 3 full-time staff members, and one of whom is a long-term sub right now for replacing retired Joe Lewandowski. And Pete is correct, he's a half-time driver's ed position. Pete worked very diligently last year, putting together a program so that we could offer it during the daytime this school year. We scheduled the program, worked with Pete pretty closely, and one of the challenges we discovered was that for a student to receive the 6 hours of classroom instruction and the 30 hours of driving behind the wheel, that within our current schedule, we could provide around 7 students per period instruction. Currently, there are 6 semesters, so we could service up to 42 students over 3 periods within that schedule. Because the number of hours of coordination that Pete has to do to have those students meet their hours of driving, they said it is a challenge. But Pete worked a way to be able to do that much during the school year. So with the retirement of the position, as with any retirement position, we take a strong look at, is this something we have to replace full-time, half-time, and then go from there. Looking at some of the needs that Mr. Frank was talking about, but not only within our own building, is there something else that we could do to provide that support to our students? So it comes down to, do we value driver's ed? Yes. Do we value the additional sections of a teacher can bring for phys ed? Yes. But we also value the opportunity to provide services to students more extensively, more fully within our program. So I sat down and I ran the numbers here, and what I did was took a look at all of our course offerings, and that includes not only the required HPE 9 through 11, but that includes elective offerings of phys ed 12, adaptive phys ed for life skill students, as well as our online learning offerings, which it's a teacher assignment during the day. We also have an online health concepts. Now we have the senior electives, which are very popular: personal fitness, yoga, current events, and of course the 3 sections of driver's ed. So all of these classes are semester courses, and they are semester-based, we said, and there was a need for 42, and we were able to work that out. But what we have discovered each year of scheduling now, the number of students who take HPE in the summer, and the number of students who take ideal HPE through the school year, those students, the total number of students we have for that, that's after consideration of scheduling. For instance, students are now scheduling their classes. And when students schedule their classes, we have to anticipate that those students and all students will have an in-class learning experience. But after we make the schedule, what we see is the in-class enrollment numbers draw down because students are taking in an ideal, students are taking in summer school. So we're watching this, and we're getting to the point I think we can gauge this a little better. So when the opportunity came along, I said, well, could we do this with 2 instructors? Yes, you can do it. There are some trade-offs, but it can be done. And Pete will probably speak a little more to those trade-offs here momentarily. So with 2 instructors, and if I took all of the students this year who scheduled those courses, and I projected it out. I said, okay, these students, let's enroll them in the same classes so we have the same number of students. Right now, we have 920 or so students at senior high. We expect to have fewer students next year. However, I still did it with 920 because I want to really err on that safe side. So what I did is I said, okay, if we take the online assignments that are given to teachers during the school day, we take those out of the school day and make those supplemental, like many of our ideal courses are. And then we reschedule driver's ed to occur as supplemental ideal for the classroom part, and then driving, if it were permitted, would occur after school and during the summer. So essentially, I'm taking those sections out of the schedule. The other thing I did was went back up into the sections that we have and reduced those sections and was able to optimize enrollments in those classes. So instead of having 23 students in a class, would have maybe 28 or 29 students in the class. There's 28, that difference are those students who are in summer school and those students who are taking it online and reducing some of those sections so that those class enrollments are optimized. So with that, I would need 28 sections with 2 teachers teaching the standard of 7 instructional assignments, and those are semestered. That'd be 14 per teacher, that'd be 28. So I'd have to be able to provide an HBE program with 2 instructors, 28 sections. I was able to do that. It just worked out in that regard. That's how it looks on paper. But Pete has some other considerations. I think are legit. And Pete, you want to share those?
Sure, yeah. Thanks for the opportunity to talk to everybody tonight. So I'm here to talk about the counter to that point. What does the fallout look like if we don't rehire a driver's ed teacher and an HPE teacher, or keep driver's ed in the curriculum and not rehire an HPE teacher? The ideal classes that are going to land outside the contractual day, the cost of those, just the quick math was like $15,000 to $16,000. That's going to be spread between myself and Larry, which is obviously a cost to the district that is worth considering. Also, I'm not sure how the driver's ed would work in terms of how that would look being paid outside of the school day. That's probably something, Jared, you're more familiar with how Mr. Sokol was paid. But that's another cost to the school district. That's,
Excuse me, just one
Sure.
quick clarification. Didn't they do some of that actual driving outside the school day? Because it seemed to me when my son took it, it was outside the school day, the actual behind the wheel.
All the driving was done outside of the school day.
It's inside the school day now.
Oh, okay.
So taking it back outside the school day and having us have a full schedule of HPE, I'd be getting paid additionally for ideal and for driver's ed. That's assuming I'd be interested in doing driver's ed after school, which I have 2 daughters, a 4-year-old and a 7-month-old. And, that's not something that the schedule is, friendly to a dad with 2 young kids. So I think that would probably be a hard position to post for, and have somebody want to be a part-time, driver's ed teacher. I know we've had difficulty finding, various positions, but that's not my job to worry about that. But so those are 2 expenses: the ideal program outside the school day, the driver's ed program outside the school day. Those are costs that the district's going to incur additionally, if this happens. And Mr. McElhaney was talking about the class numbers. So if we're keeping the 920 students, we have about that'd be about 800 students, depending on the year and depending on enrollment, that Larry and I would both see. So that's 400 students per teacher, 200 students per semester, which, if we're talking about a teacher having class sizes of 28, 29, 30 students, seeing 200 students a semester is, an additional workload and, something that isn't ideal. So some of the other things that would happen with the full HPE schedule and the ideal and driver's ed outside the school day. We have a couple study halls in the senior high right now that are 70, 80, 90. I think we have one that's over 100 students, and there's one teacher watching it. So that'll create additional strain for study halls. There are, our teaching staff has been asked to cover lunches because mental health and behavior issues at lunches have gotten so bad that some senior high teachers are covering those. So the fallout from that has been music and band practice has not been offered in certain sections. So we're starting to get pinched here pretty tight at the senior high, and I feel like losing an additional staff member, it's only going to get worse. And I don't want to sit here and be all doomsday, but there's real consequences to cutting a position, and it's not just numbers. There's more fallout than the cost savings.
And it would be a reduction in the HPE, but it would not be a reduction in position. There would be another position created, and that's what we were thinking about working on. So we would still have that position in the building, but we're looking at, are there other ways to repurpose those services so that we can support our counselors, we can support our teachers, we can support those students primarily with those types of services.
Wait, are you ready to ask the board or inform the board or this committee what in place of you are seeking? Like, I don't know if it's premature or not, and I don't want to put you in a spot. If you need more time, that's fine. But if the board would say, look, we're going to move away from driver's ed, and you have that extra spot available, what are you looking for? What would you recommend for this committee's consideration?
Can we talk about driver's ed for just a minute by itself?
Sure.
Without any other impacts?
Sure.
I have a problem with driver's ed in that we're spending over $1,000 a student to train these kids. Not that it's not valuable, but we don't spend $1,000 on a student on any other, not in physics, not in music, not anywhere else. It's a very expensive program for 42 students. That means that there's 150 students that didn't get the training in our building. Okay, if using 200 students as a class size. So we're providing $1,000 a student. We're getting about 25% of our kids trained. And it doesn't seem right. It just doesn't seem like a good investment. Not that it's not a valuable skill, and not that my kids didn't benefit from it, and not that kids don't benefit from it. But I was asking, is there an outside source that is more cost competitive, that these kids can get trained at, that we don't have anything to do with, that we could reallocate the position and that money? It's 3 sections is over $15,000 a section, and you're only able to take 3 kids in the car and train them at a time, and they have to be 30 minutes driving. I mean, it's a lot of hands-on stuff. We don't have a program anywhere in the district that looks like this, and I just wonder if there's any, if we can continue this, or whether we should just pull back and abandon it altogether.
Tom, I had a technical question for Wade or for the teacher here. Is there any ability to use a simulator rather than the actual car to log some of those hours? Because I know even in learning to fly an airplane, there is a certain amount of the hours that are allowed through a simulator, and whether that would reduce maybe some of the, and who knows what technology they've developed to have the simulator monitor the driver, the student, while he's actually driving. And so is there something like that we could use to augment? And I don't even know, my real question is there the technology out there to do that? And can it be logged for the driving hours that you need to pass the test or get this insurance certification?
So I know there are, the technology is out there. There are driving simulators. I know they run like $30,000, $40,000. So it's not something that I've, thought was a possibility and looked much into. I know just seeing that cost up front was something I was, and it's my first year doing it too. So
a car's $20,000. What I guess I really would hate to see this program go away. The question I'm asking is there a way that the program could be redesigned that we could use the simulator, do this capital expenditure, okay, and still provide that, and I don't know that. It's a question that I'm essentially asking. Are there ways that this could be done differently?
So I think a way, so in the past, students had paid when it was outside the school day. I don't know if it was $200 a student to do it. That could help defray the cost. I also was looking at the schedule, and on our Fridays, we have 31-minute periods. Monday through Thursday, our periods are 39 minutes. I don't drive on Fridays because I can't get that half hour that I need. If our Fridays are 39 minutes, I can add an additional student, which is 8 students per section, but that increases, enrollment from 42 to 48 if we keep the 6 sections. Not a lot, but it's more than nothing. So, on speaking on behalf of the costs and trying to find something that's more cost effective.
What you would do, Mr. Harley, to your original comment or question is, it'd have to be posted internally. So if Mr. Wojtowicz says, look, I don't want to do it, then it'd be open up to anyone in a collective bargaining agreement with that certification. Then after that fact, if no one else applied, then that's when we can look at an outside provider if the district wanted to pay for it. Or you could simply ask families to see if they want to pursue it on their own. But it would have to go through that chain before we didn't open up to an outside company.
That was going to be my question. Have we heard from communities or family members? I mean, I would think they would support. I think they'd be thankful to have it in the school.
Yeah, so I had 20 students last semester, and I told them, I said, there's a chance that this might not be offered next year to students. And I said, if you found this class valuable, I'd appreciate if you provided feedback that I could share with the board. And I had several students that got a hold of me, and I had some student testimonials to pass out here. If anyone's interested in reading those.
I'm not disputing that it's valuable. Okay, it's incredibly valuable.
I was just answering a question about student voice.
And the safety
and
of
community
children
voice.
is higher in our priorities. I'm agreeing with Walter. Is there some way we can do this at a lower unit cost, and provide the same certifications? I'm interested in that. I think it's a mistake that we only do 25% of our students, but to do that, we're going to have to hire a full-time driver's ed teacher too, like we had. And at $1,000 a student, it's not sustainable.
Okay.
So
As a,
as soon as you're done, Terry gets to go. He's had his hand
okay.
up for a long time.
I'm sorry. As a person who had to 9 months ago go and look for someone to teach my child how to drive, there was only Cantons available in our area. My husband and I have not had the time to teach our children how to drive. And I know people in the community also feel the same way. The school is the only way that they've been able to get any kind of safe driving. And I have to point out that I have not heard in the news any child dying from a car accident that they were driving in.
Don't bring it up.
And so I want to keep that statistic there. I want the safe driver's lessons to continue
But you
in
realize
school.
it's only hitting 25% of our students.
They have a couple of years to take it.
No. He can only do 40 some students, 50 students a year. The class is 200 kids. Okay, so out of that 200 kids, every year he does 50 kids. Next class, 50 kids. Okay, it's only 25%. So tell me how we get to 100%.
It's an elective, and
No, I understand that, but
not every student wants to take it.
I understand that too, but if it's that important,
Right,
okay,
and I agree it
that
is.
these kids need to learn to drive safely, and I agree because I saw how Mr. Sokol's effect was on my children.
Mhm.
Okay, much better than me teaching them to drive.
Oh, yeah, because I don't want my kids to drive like me, no.
But then we need to expand it. Terry's
Yeah.
next.
Yeah, Terry, we may have to defer a final decision on this driver's ed till we've had another chance at this. Terry, you can go, but we're running close into our executive session time, and Cindy, I think, has some other things we need to try to cover.
Yeah, thanks. And that's what I was going to say, Walter. It's a lot of good discussion. I think a lot of us would favor keeping it, but there's too many questions my opinion is we're not ready to make a decision yet. I'd like to see these options written out with some pros and cons to them. The simulator was a good idea. There's some other things that have been mentioned previously. And then two more things. One is, I think we ought to ask our students and our parents when they would like to take this, either during the school day or after hours, and see what that survey would show. And then if it showed that it was off hours, could we post the position and modify the schedule of the employee? Instead of them starting in the morning, could they start at lunchtime or something and then work into the evening? So there's a lot of ideas here that have not been explored. So I'll shut up. Thanks.
I know some feedback we've gotten from students that are athletes and have jobs after school. They weren't able to take it when it was offered outside of the school day. And they were very appreciative that, they had the option to take it in school when they wouldn't be able to otherwise.
Summer was also a very good option for students. Some of those that Peter talking about, that Joe had full sessions in the summer.
If I could speak in addition, sorry, he's dropping there. In terms of faculty, I think there's a couple decisions here. The driver's ed and the debate that you have is very important. And I think we need to make consideration for our children's view of driver's ed. Additionally, as we're here on the agenda, the position, I'd like to encourage or ask for you to consider the third phys ed position in general, regardless of where we make the decision with driver's ed. If you look at 920 students, or even if it's rounded to 800 students that enroll in it, you're still dividing that 400. It takes the humanity out of it. So many students relate closely to the physical education teacher. That's a person that we see too. Right now, this suggested that's only 2 male faculty at phys ed, unless that changes throughout our elementary buildings, then we have no female staff in that position. Mr. Wartorsh should mention the study halls. They're overloaded. I understand there's some works to maybe improve that, but since the PSERS crisis, we've cut nearly 20 positions out of the senior high, and we're at the point where it's difficult to staff the things, the SAP, the gifted. We just don't have the periods in the day to spread among each other. It disheartens me to see that the numbers, well, if 23 is where we're at now, we can save a position and move to 29 students in a class. I feel as if we're maxed out. I feel as if we offer the phys ed position, or we ask to hire the phys ed position and the behavior and health coordinator, the benefits throughout the building everywhere. It will give us opportunities to get faculty back in positions that have been very sparse lately. So I would ask you to consider it as, what do we do with driver's ed? Where's our plan to move forward? Can we hire a physical education teacher, knowing that there'll be some opportunities within periods of flexibility to utilize that staffing? And can we hire a mental health specialist to help us with the uprise and the needs that we need and that humanitarian work that teachers often do that does not fit in the schedule or matrix? Thank you.
Cindy?
I think that we're right. We need to talk about this some more, and tonight is not the time because we do have a time crunch. So everybody keep all the ideas in mind, keep them written down, and we will discuss later.
Ms. Cinda, for the sake of time, Ms. Cinda, if it's okay with you, items C, D, and number 4, I can take during the regular meeting if you want, because those are items you have to vote on to expedite this process if you'd like, or we can talk about it here. It doesn't matter to me.
I'm not sure
We're
we'll be
just
ready
running
to
out of
vote on some of those positions either tonight, if we don't have discussion.
I mean, we can discuss it at the regular meeting if you'd like.
That, I'm fine with support staff. I'd like to talk about some of these other things.
I'll defer to you. It's 6:39.
I mean, like I said, doesn't have to be tonight, but then I would prefer to defer the vote.
Well, we need to we do need to get D taken care of though in a timely manner, yes? So,
Yes, you have the right by when it's brought up to motion, if you want to bring it up in a motion at the regular meeting to discuss it then. It would, yes, make that meeting longer, but you could talk about it then, or we can postpone it. It's really what the pleasure of the board.
Tamara, what do you think about C, D, and number 4? Do you have any issues?
Again, C, I would like to know more about, so, D, maybe we can talk about that at the regular meeting.
Terry, what do you think?
Yeah, as long as we'll have adequate time to discuss it at the board meeting and we could always table it, right?
Okay, and then if we run over on executive session, are we going to do executive session after the meeting again or not?
It's always,
It depends on whether we cover everything in the executive session that we need to cover. Okay.
That's highly unlikely.
There is that possibility. We could maybe structure the executive session for issues that we have to vote on beforehand. But yes, we do need to kind of move on if we can.
Yeah, let's go ahead and we'll do those during the meeting.
okay. The last thing we have to discuss, again, if you'd like to end the meeting, we can always bring it up next week, but we need a decision sooner rather than later, is what would the board like to do with regards to synchronous instruction? Rob is working on a survey to families to garner their interest. I believe it's out. Rob, you want to give an update about where we stand? What we try to do, Ms. Cinda, was try to find out how many people would like to say synchronous going into next year. It's our recommendation that we really take a look at what we're doing at the high school because it didn't seem to be productive. And the fact that only 4 kids were taking advantage of some of the synchronous courses, we can then take those and put those back into the schedule to reduce, increase sections, reduce class sizes. So we think that makes sense. And we also like to talk about the idea of eliminating kindergarten and first graders in the synchronous program. As there's only, I think, a 1 or 2 kids, I think, that wanted that program into next year. So we want to talk about, because we'd like to then repurpose some of those teachers back into some of those vacancies that are on the list. As you know, those are full-time hires. Those are our staff. I'd like to make sure they have a seat before we then try to go hire someone else outside of that. So we'd like to have that conversation, whether you want to do it now or do it later because we're running out of time, but we do need a decision from the board sooner on that than later.
Well, I can say for me, only having 4 students at the high school, I think that COVID is over. I think that we need to put that in our pocket for later. If we need to go back, we could always go back, but I think that we need to free up those sections. The thinking that having synchronous for kindergarten and first grade is not as optimal as having the children in the classroom with their peers and their teachers, I fully agree with that. Talking about the ESSER grants, I've asked for a complete listing of ESSER income and how we're spending it. And so, you know, I don't know if I'm comfortable using ESSER grants or ESSER funds next year. I'd like to see that. But the way I feel right now, synchronous at the high school, we can go without, and at the elementary level, at least the kindergarten and first grade could be dropped.
Yeah, real quick on that, I'll defer to Rob and Wade to give you the numbers to make sure I'm not misspeaking, but please know, Ms. Cinda, the board already approved ESSER funds to be authorized for the synchronous teachers. So that's already authorized. Just want to clarify.
I just want to see the numbers.
Sure, fair enough. Wade and Rob, anything you want to clarify?
So far, there's about half the students' parents have responded to the survey, and 64% intend to bring their kid back into the school building next year. So that's good. So the need will be lessened in synchronous education, specifically the elementary school. Currently, there are 4 students in the kindergarten. One of them has responded to the survey, and they intend to come back in person as well. So you're talking about 3 students who, again, to allocate 1 teacher for 3 students, you know, if we're talking about, you know, driver's ed, that one is kind of a no-brainer in my opinion. And I think any reading teacher in this building would say that that's not an ideal place for, no pun intended, to teach reading anyway. So if we could have those students back in the classroom and not offer it for K at 1 and begin the ideal offerings at grade 2, I think that makes most sense academically and financially. to Wexford.
Wade, anything from, did I misspeak at all when I was referring to the high school about the low enrollment in the synchronous courses?
No, you didn't speak. We were able to schedule it this year, but as you had indicated, that did come with a trade-off of, not being able to offer that teacher that assignment for in-school enrollments. So it did overall increase class sizes in those other sections, and it did limit our ability to use those particular teachers for other assignments.
I think Terry had his hand up.
Yeah, I agree with what Cinda said, but the thing I wanted to add on to that, if we are able to repurpose these positions under 2A and 2B, does that change what we talked about up above in the agenda with the hiring of the new teachers?
No, some of those teachers would be put into some of those vacancies. So again, you're authorizing us to post, interview, and advertise. You're not authorizing, we're not hiring tonight. So what we would do is, based on your decision tonight, if it stays steadfast with kindergarten and first grade being eliminated, we'd look at those positions and then move them into some of those vacancies.
Okay, thank you.
Tamara, anybody else? Tammy, Jim?
I agree with Cinda on what she said. I'd also encourage you to take a look at second and third, and if the numbers are low there, to do the same. I think it's almost impossible to teach reading to kids at that age group when they're not in the room with you. So I would encourage you to look at the second and third grade too.
Agreed. Like, I think Miss Cinda said it best. When we needed them, they were there and they did an incredible job. Just right now, we have a lot of people coming back, a lot of people trying to return to that normalcy. They feel safer, they feel better. I think it's an expenditure, despite what your beliefs may be. We spend a lot of that money on ESSERs through vendors and things that we can eliminate quickly and move forward. Those positions, I can't. They're ours. And the more I can get them back in the classroom and get them in front of kids, I think the better off we are long term. But that's, let us continue to monitor the data, see where we're at, and we can bring it back. But it's up to the board, but I agree with your sentiments that the more we can get in front of kids, the better.
Yes.
Okay.
Yep, move on.
The last thing, Rob is going to give a quick update. He's been working with Dr. Ankrum about the literacy graduate assistants and the partnership with IEP. So Rob, do you want to go over that?
Yeah, very briefly, the summarizes this. The price per graduate assistant has increased significantly. It's gone from $15,000 per graduate assistant to $27,500 per graduate assistant. Now, these graduate assistant positions are very, very valuable. The teachers or the principals use them in the elementary schools, but the cost obviously prohibits the number that we could hire. We're asking that you approve the contract tonight, and then we will interview. And if we find quality candidates to finish that we believe will bring value to the table and help our students at that price, we absolutely will bring them forward for hire. And if we are not completely satisfied with the candidates, obviously we would rethink bringing them before you, because we don't want to just put at that price. We're not talking about the expectation for the response goes up. Now, in their defense, they are increasing the number of days that these graduate assistants will be on campus. Currently, they're on campus 3 days a week. They will be on campus 5 days a week. These graduate assistants oftentimes are pulled to substitute, and they do a fine job doing that. So we have high quality instruction because these are certified teachers who are working on their masters in reading. So they are very highly qualified people that we can put in as a sub, so that there is value there, and it will reduce our sub costs as well. So there is some give and take here. All we're asking for tonight is that you approve the ability for us to maintain this partnership. The decision on if we hire and how many we hire, we can revisit at a different day.
How many do we have now?
We have 6 now. We are currently, at this rate, we would only be able to bring back 4.
Okay, that was the next question.
Yes, ma'am.
And Ms. Cinda, we're working, again, authorizing ESSER's funds to pay for that, but prior to use of ESSER funds, this was a district budget item that was paid for.
This is the better end.
So the cost is because of the additional 2 days per week?
That's part of it. The cost, I believe, is, and Dr. Ankrum explained that they have not raised their price in several years, and it's just, they've tried to not raise it.
They keep it for another several years.
They've gone to, they're in a bad spot, and they have to charge what they need to charge to make it attractive for these students to take these positions. because they go elsewhere, so, and if, we see value in having this homegrown reading specialist program, then, we have to be their partners there. And I have no problem with it, the fact that a lot of places have graduate assistants at very competitive rates. So what they're asking isn't ridiculous. It just limits how many we can bring on board because, we don't have that much budget.
What you're facing with is the talent wars coming back again to the district now, where new teachers are graduating and they can get a full-time job, where in the past they were a little bit more selective and they went to these master's programs. So these people are getting hired quicker and faster in school, and they're making a choice. Do I want to go to get my graduate degree, or do I want to go work and then get that on the side? And I think you see, as you see less kids in the system, this is an offshoot. The nice thing about the change, correct me if I'm wrong, Rob, they will follow
Our schedule as well. So
that's a huge
they used
benefit.
to take spring break. They won't get spring break. They used to stop for,
That's a
whenever
big
the-
win for
In
us.
December, they stopped coming
They
for their
would
full-on
stop at
Christmas break.
commencement and not
They
come
will
back
work
again
until
Tuesday.
Christmas. They come back when we come back. So they're on our schedules. There is an increase in
Workload.
availability and work. So
So it's not just the 2 days a week.
no,
It's
it's,
the 2 days a week. Plus I saw the spring break and I guess I didn't register, so they will follow until the end of our school year.
not to the end of the school year. They will graduate in May,
May.
but
Yep.
they won't have an extra special long Christmas break, and they won't have
Okay.
spring break. And they come back from Christmas break when we come back from Christmas break. So they're going to be available more often, 5 days a week. So there is an increased value we're getting a lot more value for the price increase. I don't, again, it's unfortunate that it had to go up so much so fast. But I don't think we should throw the program out. I think we just have to be realistic about how many we can hire at this point.
And we'll still use them to sub when needed.
Absolutely.
Absolutely.
Yes, ma'am.
Jared, I'll need to abstain from this.
Lastly, we said that there'll be 2 donations brought forward tonight for the board's consideration. One from Mark Arbuckle, $5,000 for the science club, and one from the Adopt a Classroom initiative. Delaney Subaru has donated $3,000 to East Pike, and that'll be split among the grade levels. I talked to Mr. Sprinker. He has a plan in place for that. So respectfully, we are asking the board to adopt those as well tonight.
Okay. Terry doesn't have his hand up, I don't think.
No,
Terry,
and
do you have
Miss,
anything you want to say? Maybe he left.
Nothing heard?
Ms. Cindy, again, just to make sure we're on the same page, we're having permission tonight to go ahead and work with Wade to eliminate the synchronous at the high school. We're looking at restricting K1, no K1 into synchronous, and then we're going to look at the numbers and see where we're at to possibly eliminate the other grade levels and put those people back into full-time teaching positions in person, correct?
Yes, I do want to ask though, should COVID strike again? Do we have the flexibility now? We know how to do it, to switch to synchronous
Yeah.
in an emergency.
Yeah, the teachers have done an incredible job with that. I mean, can we get better in some areas? Like anything else, sure, but I think we can
Well, I
be
hope
done.
we don't have to get that.
Yeah, me too, please.
Okay, just so we're not, redo everything again, as
Absolutely.
long as we're flexible.
And the principal did a good job too as well, leading through that.
We have the blueprint now, so we can.
Excellent.
Hopefully we never have
Okay.
to use it again.
Yes.
All right, anything else? Hearing nothing, we're
Okay.
adjourned.
Thank you very much. At this time, we'll enter an executive session.
Yeah, we need to go into executive session.